All right, today we're jumping into something really fascinating, the surgical evolution of craniosynostosis. If you're heading into medicine, this is a masterclass. It's all about how surgeons tackled a huge problem, a brain that's growing like crazy, trapped inside a skull that just won't expand. It's a story filled with brilliant ideas, some really tough setbacks, and just nonstop innovation. So let's start with what you'd see in the clinic. This is the most common presentation, called scaphocephaly. See how it looks kind of like a boat-shaped skull? That's because the sagittal suture, that seam that runs right down the middle on top, fuses up way too early. And when that happens, the skull can't grow sideways like it's supposed to. And this really gets to the core of the problem. A baby's brain, it just explodes in size in those first couple of years. The skull is supposed to be this clever, expanding container with these flexible seams, the sutures, that let it grow. But what happens if those seams lock up too soon? Well, you've got a rigid box with a growing brain inside. And I mean, the stakes, they're just incredibly high. And that condition right there is called craniosynostosis. It's super important to remember that this is not just a cosmetic issue. When growth gets restricted like that, it can cause the pressure inside the skull to build up, and that can have some really serious impacts on a child's development. Okay, so how did doctors first even try to tackle this? We have to go back in time for this one. Our story really kicks off in the late 1800s with some of the first and honestly incredibly bold attempts to do something about it. So the first big piece of the puzzle came in 1851. This brilliant pathologist, Rudolf Virchow, was the first to really connect the dots. He saw the fused sutures and realized that's why the skulls had these odd shapes. But knowing the problem is one thing, and operating is another. It took almost 40 years before anyone was brave enough to try. Then, in 1890, a French surgeon finally did it. But the first attempts, they were dangerous. The death rates were so high that a very influential pediatrician named Abraham Jacobi basically shut it down, saying it was too risky. And that stopped progress for decades. And this is the guy right here, Odilon Lanalong. He's the one who took that huge leap. In 1890, he took Virchow's theory and walked into an operating room to perform the very first documented surgery for this condition. His idea was actually really logical and kind of simple when you think about it. It's called a strip craniectomy. The logic was, if a suture is fused shut and stopping growth, well, why not just cut that strip of bone out? You'd essentially create a new artificial suture, release that pressure, and give the brain room to grow. This quote is amazing because it really shows you what people were thinking back then. A top neurosurgeon, Victor Horsley, he sees what Lanalong is doing and he's just completely sold. You can feel the desperation in his words, but also this incredible sense of hope that maybe, just maybe, they finally had a solution. But the reality? It was absolutely brutal. You have to remember, this is before modern anesthesia, before blood transfusions. Operating on a tiny baby's skull, the blood loss was often catastrophic. And even for the kids who survived the surgery, the body's natural instinct is to heal bone. So that new suture they created, it would often just fuse right back up again. The idea just didn't work, and it was abandoned. So for decades, it felt like a dead end. The problem just seemed impossible to solve. But then, fast forward to the mid-20th century, and a whole new generation of surgeons comes along, and they're looking at this with a totally different philosophy. And this slide just lays out that shift perfectly. The old way of thinking was kind of passive, right? Just cut out the suture and hope the brain pushes everything into the right shape. But the new philosophy, it was active. It wasn't about just releasing pressure anymore. It was about getting in there and actually rebuilding the entire skull, reshaping it into a more normal form. And the person who spearheaded this new era was another brilliant French surgeon, Paul Tessier. I mean, they call him the father of craniofacial surgery for a reason. His work in the 1960s just completely revolutionized everything. He's the one who introduced this idea of total cranial vault remodeling. You know, what was so genius about Tessier wasn't just his surgical skill. He got that you can't treat the skull without thinking about the brain, and you can't separate how it works from how it looks. So he pioneered the multidisciplinary team. He said, we need neurosurgeons to protect the brain, and we need plastic surgeons to rebuild the bone. And of course, you need specialized anesthesiologists to keep these tiny patients safe. This whole team-based model, that's now the gold standard, period. Okay, so cranial vault remodeling was a huge step forward.
no question. But it was still a massive open surgery. So as we get closer to the end of the 20th century, surgeons started asking the next logical question. Is there a way to do this that's less invasive?
Because even though the open remodeling worked, it was tough on these little patients. We're talking long, complicated surgeries, a lot of blood loss, and pretty long stays in the ICU. That challenge is exactly what pushed the field toward its next big evolution. So in the 90s, two surgeons, Jimenez and Barone, they had this amazing idea. They basically looked back at that old strip craniectomy concept and thought, what if we could do that but with modern tech? So they used an endoscope, a tiny camera, through a couple of small incisions to remove that fused suture. And here's the clever part. Instead of doing all the reshaping in the OR, they used a custom molded helmet after the surgery to gently guide the skull into the right shape as it grew. And that brings us to the two main ways we do this today. The choice really boils down to the baby's age. The endoscopic surgery is perfect for the really little ones, usually under 4 months old when their skull is still soft and easy to mold. You get less blood loss, a shorter time in the hospital, but you do need that helmet therapy for several months afterwards. The big open surgery is usually for older infants. It's more of a one-and-done definitive fix. So here we are in the modern era. We've got two really good, really well-established options, which means surgeons and families now have a choice to make. And of course, that leads to a super important question. We know both surgeries can fix the shape of the skull. That's great. But is one of them better for the brain long-term? Does one lead to better cognitive outcomes down the road?
Well, to answer a question like that, you got to look at the data. And a huge study just came out in 2024 in JAMA Network Open. What they did was follow a bunch of kids who'd had either the open or the endoscopic surgery, and then they tested their cognitive function years later.
And the results? It was honestly fantastic news. They found no statistically significant difference in cognitive outcomes between the two groups. What does that tell us? It suggests that as long as you pick the right surgery for the right patient at the right time, both options are excellent for letting that child's brain develop normally. So what's the big takeaway here, especially for you guys? It's all about timing. Remember, that endoscopic option? It only works for the youngest infants, under about 4 months. That means getting an early diagnosis and getting that baby to a specialty center fast is absolutely critical. It's the only way to make sure the family has all the options on the table. So when you boil it all down, modern care for craniosynostosis is built on teamwork. It's all about having two goals at once: protect the brain's function and restore a normal appearance. You have to tailor the plan to the patient's age, and you have to be really on top of the post-op care to get the best possible result. You know, it's just an incredible story. From Lanalong's very first attempt, to Teshier's game-changing team approach, and then to the endoscopic revolution. It's just been this constant march of progress. And it's definitely not over. When you think about technologies like AI-driven planning and 3D printed surgical guides, it just makes you wonder, what is the next chapter of this story going to look like?